Hello, I'm Dr. Darin Smith with the Baptist Eye Surgeons. I'm here to answer your questions for our Ask Me Anything session. So we've got some questions that I'd like to answer today. So we have a question of about lens implants. What are lens implants? What are multifocal lens implants? And why do we even need a lens implant? So let's go first talk about what a cataract is. So the lens implants are really asked in the context of cataracts and cataract surgery. A cataract is simply the natural lens in your eye that's gotten cloudy. That's all a cataract is. So when we do cataract surgery, we just remove the natural lens in your eye and replace it with a clear plastic lens implant. It's very safe, very easy. Surgery takes about 10 minutes. So it's not too bad of a thing to do. We do one eye at a time, usually separate the eyes by a couple weeks. So what's the deal with the lens implant and why do we even need it? So back before lens implants were available, cataracts could be taken out, but there was no lens implant to be put in. And so people would have to wear very, very thick, what we're called aphakic spectacles, basically Coke bottle type of glasses. And that was the only way you could see anything after cataract surgery. Well, obviously we don't have to worry about that anymore because we have lens implants, at least in our country. There are still parts of the world that don't have that technology, so we're very blessed to have that. And so there's three different types or categories of lens implants. There's what's called a standard lens. So a standard lens is usually what's put in the eye. That's what's covered by insurance plans. Basically, standard lens will help for your distance vision, but doesn't do anything for the up-close vision, and doesn't do anything for something called astigmatism. Which brings me to the second type of lens implant, which are astigmatism-correcting lenses, or what are called toric lens implants. So toric lenses basically help treat astigmatism, reduce or eliminate astigmatism, to give you better vision without glasses, at distance or at near, but not both. Most people opt to try to get the vision better at the distance and then just use some reading glasses for the up-close vision. And then the third type of lens implant is what's called a multifocal lens. And there's a few different types of multifocal lenses, but with a multifocal lens, you get to see the distance vision, the up-close vision, and hopefully everything in between. As you can imagine, the premium toric lenses and the multifocal lenses do cost money, depending on which type of lens that you're getting. It can be anywhere between $1,500 and $2,750, but that price can change, and different practices will have different price points depending on what they do. But as a general rule of thumb, that's probably a ballpark for what you might expect to pay for a premium lens implant. And unfortunately, none of that's covered by any insurance, so that's all out-of-pocket expenses, which is one of the main reasons that most people get standard lenses, which works great and no problem. As far as cataract surgery and how long do these lens implants last, it's great. Cataract surgery is a one-time deal. Cataracts never come back. In fact, it's impossible for a cataract to ever come back. And the lens implant, like I mentioned, is made of plastic. It's an acrylic plastic. It will last you the rest of your life. And not only that, but one of the reasons as we get older that the eyes change and people need changing eyeglasses, one of the biggest reasons for that is the lens changes, and as the cataract develops, and just lens changes generally. Well, the lens implant's plastic, so it's not going to change. So vision can be very, very stable for many years after cataract surgery. So it's nice. So sometimes with cataract surgery, not only do you get rid of that cloudy lens, but you can actually fix vision, and it stays fixed for many, many years to come, very often. So those are great questions about cataract surgery, lens implants, what type of lens implants, and that sort of thing. There was also a question about, is there a way to get these lens implant technology put in without actually having cataracts? Well, the answer is yes. It's basically, you can have cataract surgery done when you have no cataracts. We call that a clear lens exchange. It's basically cataract surgery though. So it can be done. The downside is no insurance pays for any of that. So it gets very, very expensive very quickly. So it can do some things that, for example, that LASIK cannot do as far as you're getting your distance and you're up close. But it's a different ball game altogether. It's apple and oranges kind of comparison to fixing vision with LASIK. It works in a different fashion, and it's very expensive. But it can be done, and I've done it on a number of folks who have been very, very happy, and for years haven't had needed glasses for anything. So it can be done, but most of the time the lens implants are being put in at the time of cataract surgery, and then people might just upgrade to a kind of a more of a premium specialty type of lens. As far as there's a question about, will I feel the lens implant in my eye? And the answer would be no. The lens implant is actually inside the eyeball. So when we're doing cataract surgery, we're actually working inside the eye. And so this is not like a contact lens that you put, on the eye. This is inside the eye, and there is no way anyone would ever feel it. And the lens technology, the plastic, is very what's called inert. It doesn't cause a lot of inflammation or reaction. Now, right after surgery, you can expect some inflammation just from the surgery, but long term, these lens implants are very well tolerated, and like I said, will last a lifetime and really don't cause any kind of sensation when they're in the eye. Let's see, he had another question about what happens if something goes wrong with these lens implants. So a couple things about that. One thing that's very, very common with lens implants is when we do cataract surgery, we're actually putting that lens implant in something called the capsule. And the capsule is what holds your natural lens in place. And after cataract surgery, it is what holds your lens implant in place. And so it's very, very common for that capsule to get hazy after surgery, and that can happen within a few months, or it could take many, many years, or it may never happen. But it does happen, and that's very easily fixed with a little laser treatment in the office. No big deal, very safe to do. There was another question about, well, what if that lens implant becomes dislocated? Well, that can happen. It's quite rare. If you look at the number of dislocated lenses versus the number of lens implants that get put in annually in the United States, which is a huge number, there's very few dislocated lens implants. And so that is a big deal. If it were to happen, it's all fixable, but it requires more trips to the operating room. Usually, if the entire thing dislocates, sometimes lens implants need to be sutured in. With modern day cataract surgery, there's no sutures involved. But if we have to deal with a dislocated lens, then sometimes a lens implant would have to be sutured. But that's very, very rare, not usually associated with routine cataract surgery. That usually has another reason going on, that's just part of another group of problems that a patient is having. But that's not something that normally we have to worry about on a regular basis. Well, anyhow, I hope I've been able to answer a lot of your questions concerning cataract surgery and lens implants and the things associated with that. So, some people pray that they never get cataracts because they're afraid of surgery, and when in fact a lot of people should be praying that they get cataracts so we can get them done and fix the vision. The point is, it's not that big a deal to have cataract surgery. It's a 10-minute procedure, and of course having surgery on your eye is going to provoke a little anxiety, and that's normal. So it's normal to be anxious about cataract surgery, but it's really not that bad of a thing to go through. And so I hope that answering these questions have put your mind at ease and give you a little bit of information so you can make a good informed decision on what you want to do as far as what type of lens implant to be put in your eye. So all this information, my understanding, will be put up on our Facebook page, so you can follow the Facebook page, as we'll be doing different Ask Me Anything sessions with some of my partners, other doctors. We'll be talking about a whole host of different topics, and I hope that those are very informative and helpful as well. So again, thank you for taking some time with me today. I hope you have a wonderful day. God bless you, and take care. Thank you.